Hey, good afternoon, everyone. Thanks so much for joining me here on Wave Now's Ask the Doc. It's been a minute since we've done this segment, so I'm happy today to be jumping right back into it with you. So today we're talking about epilepsy. If you didn't know, nearly 500,000 children in the U.S. they are living with epilepsy, and about 50,000 more are diagnosed each year. So today we are teaming up with Norton Children's neurologist, Dr. Marie Clements. Excited to have her today. Thank you so much for joining us. I really appreciate your time.
Hello, happy to be here.
So, first, let's talk about epilepsy. Tell us a little bit about what is epilepsy. What do you want folks to know about today?
Yeah, so epilepsy really is diagnosed when someone has had more than one seizure. And those seizures were not provoked, meaning they weren't caused by something like a fever, a low blood sugar, or other temporary cause. Seizures essentially happen when instead of all the parts of their brain doing their own thing, suddenly all the a certain part or multiple parts of the brain are firing at the same time or in sync. So this abnormal electrical activity going through the brain that can cause people to have an unusual movement or feeling or behavior. Epilepsy generally happens in around 1 or 2% of children.
Why are we, what causes, like, is there a cause for it? What brings it
Yeah,
about?
great question, and something many patients and families ask too. So, epilepsy can have a lot of different causes. So, for some kids, it can be caused by a structural change in the brain that's causing seizures, often something maybe a patient was born with. Um, for some patients, we'll find some kids have a genetic change or a change in their genes that's causing seizures. For many kids, though, we actually don't find a cause for their epilepsy, and that's okay too. Really, the most important thing where we want to figure out is the right treatment for the seizures or for the epilepsy.
Are there certain ages maybe where epilepsy is more likely to appear, and does it affect boys or girls more often? Do we know that information?
Yeah, great question. Epilepsy can be a little bit unpredictable, and we can see it happen at all ages, anywhere from the first day of life throughout the rest of the lifespan. So we see children who start having seizures in the neonatal period, in infancy, and toddlerhood, early school age, adolescents, teenagers. And I think that can be tough, right? Because families and kids feel like, gosh, I was fine until XYZ age, and then this came on. But unfortunately, epilepsy can start at any age. There are certain types of epilepsy that affect boys more or girls more, but overall, epilepsy affects boys and girls pretty equally.
I can only imagine, as a parent, how frightening that has to be when you see your child having a seizure. Walk me through just what parents are experiencing.
Yes, great question. I think seizures can be so scary. A new diagnosis of epilepsy can be really scary. Seizures can be unpredictable, and each seizure, even if it's brief, feels like an eternity when the parent or loved one is witnessing it. So parents go through a lot, and families experience a lot. Siblings. Witnessing seizures of people they love can be really challenging, and wanting to make sure we find the best way to treat those seizures and control them is so important.
If you're joining us live right now on our social media platforms, if you have a question about epilepsy in children, please put it here on the comments. I will try to get it over to Dr. Clements as fast as I can. Or if you have a personal story you want to share, please feel free to do that here in the comments. I know sometimes, we all feel like sometimes we're dealing with something alone, and you're not. And that's obvious by the number of people who are living with this and continue to be diagnosed, Dr. Clements.
Yes, absolutely.
So, why can epilepsy be dangerous?
Yes, great question. So I do emphasize to everyone that really most seizures, the vast majority of them tend to be very brief, stop on their own within 1 or 2 minutes, and do not cause lasting brain damage, which is often the first thing families are worried about. However, though, when seizures go on too long or happen too often, if they're too long, rarely they can cause brain damage or even very rarely affect the breathing, which can affect the heart's ability to beat, and very, very rarely cause something called sudden unexpected death in epilepsy or SUDEP. So this is one reason why, even though this risk is so low, we want to do everything in our power to decrease it as much as possible, control the seizures, and make this risk as low as it can possibly be.
Okay, we have our first question. I want to get it over to you. Katie, hold on, I'm going to walk over because I can't see very well. Katie Patton says, what do I do if my baby has a seizure? Good question. Thank you for asking that, Katie.
That's a fantastic question. So, what to do if you're worried your child has had a seizure? So, if a child doesn't have a diagnosis of epilepsy yet, but they're doing something strange that makes you worry they could be having a seizure, the first thing, of course, to do is make sure your child is safe. If they seem to be actively seizing, you can turn them on their side. Don't put anything in their mouth. See how long it's lasting, and call for help if needed. Certainly, if it's going on for several minutes, or if the child has seemed to stop breathing or has a change in their coloring, calling 911 for help is really important. If something very brief happens and we're not sure whether it's a seizure or your child does something weird, and it's not quite clear what it was, a video often can be very helpful, especially if it's something that happens multiple times. Taking a video and showing that to your child's doctor to see, hey, my child did this odd thing. Can you help me figure out what it was? Can be quite helpful to figure out next steps.
That's a really good point, to just stop and take a video. So you have, sometimes in the panic of it, right, you may have a hard time explaining what's happening, and it's all can be very scary. So I'm glad you mentioned that. Another person posted, Olivia Comet said that my son, Shiloh, is epileptic. He has, I'm going to say this wrong, so forgive me. And Dr. Clements, you can correct me. Polymicro.
Gyria,
How do I say it?
polymicrogyria, maybe?
Yes, I think so. Norton Children's has been wonderful. Olivia, thank you for sharing that. And we are very lucky that we have Norton Children's here in our backyard, and great physicians like Dr. Clements that can help people. So I appreciate you sharing that. And for folks who are joining us, again, if you have a question for Dr. Clements or you have a personal story you want to share, we really want to hear it. So how do you diagnose epilepsy?
Yeah, good question. Really, the diagnosis is primarily, we say clinical, meaning if a child has an event that worries us for seizure, their doctor, their neurologist will want to hear from you or whoever saw it in great detail about what were they doing before? What was the first sign that something was off with the child? Then what did they do next? Then when it was over, how were they acting? Those are all such helpful clues to figure out if something is a seizure or not. In addition to that, history from the family, like we talked about, videos can be helpful. And then we have a few other tools, things like an EEG, electroencephalogram, or a brainwave test, can be helpful in the diagnosis of epilepsy. Other things like an MRI image of the brain can be helpful too, and sometimes genetic testing. So those are the other tools that can be helpful in diagnosing or working up epilepsy as well.
Okay, so we've talked a little bit about this, but give me some more clarity, Dr. Clements. What does epilepsy look like? What would a seizure? I mean, I think most of us kind of think we know what a seizure looks like, but is it obvious?
Yes, no, that's an awesome question because seizures can look a lot of different ways. Some seizures look like those you might have seen in the movies or on TV, where someone might lose consciousness, have stiffening or shaking of their body, and things like that. Whereas others can be a lot more subtle. Seizures for some kids involve a sudden pause in what they're doing or mid-sentence where they might stare off. They might have some fluttering of their eyes or lip smacking. And they can really look a variety of different ways, just depending on where they start in the brain. So if you notice your child acting strangely or doing a similar thing over and over, consider talking to your doctor about that.
Okay. Katie Patton, I'm loving your engagement, Katie. I'm going to give you a shout out on that. So I want to get another question that she has. It's a good one. Are there things that can commonly trigger seizures in kids that parents should avoid? Another great question, Katie.
Yeah, great question. So there are a few things we know that can commonly trigger seizures. The most common things we watch for in a child who has a diagnosis of epilepsy already, the three most common things that can make seizures more likely. One is missing a dose of their medicine or multiple doses of medicine. Another one is being sleep deprived. So sometimes we don't have control over how well our children sleep, but sleep deprivation can be another trigger for seizures, as can illness. So those are three things we watch out for children who already have a diagnosis of epilepsy, and we want to make sure we're doing what we can to avoid those things. Other things that are known to trigger seizures for very specific patients. Some patients are very sensitive to certain lights or flashing lights. That's something we test for on a patient's EEG or brainwave test, so we can tell with some clarity whether someone's epilepsy is or is not sensitive to that factor.
So is there a cure for epilepsy, or is it once you have a diagnosis, you have to learn how to manage and respond to it?
That's a great question. In terms of treatment for epilepsy, really there are three ways that we treat epilepsy. For most patients, it's a little different for each patient, but for most patients, the first treatment is starting a anti-seizure medicine to help prevent future seizures. Around 70% of our patients become seizure-free with their first or second anti-seizure medicine. So for many children, medicine is very effective. It's not a cure for epilepsy, but it does often bring seizure freedom for many of our patients. There are some patients, however, who continue to have seizures despite trying several medications. And in those patients, we talk about some other treatment options like epilepsy surgery or diet therapy that can be really helpful for patients as well.
So, of course, we've come a long way with technology and advancements, but what sort of advancements are there now for treatment of epilepsy?
Yes, that's an awesome question. So there are advancements, one in terms of new medications on the market, more access to diet therapy. A lot of the exciting advancements too have come in advancements in epilepsy surgery. So for example, when we're trying to figure out exactly where the seizures are coming from, we have a variety of tests we can do to figure that out, from imaging tests to EEGs on the scalp to even what's called intracranial or stereo EEGs, where electrodes are implanted in the brain to precisely locate where the seizures are coming from, and then figure out if that area could be addressed surgically to make the seizures go away.
All right. That's very interesting. What challenges do families have in navigating an epilepsy diagnosis, and how do you support them?
Gosh, yes, there are a lot of challenges in navigating an epilepsy diagnosis, right? A new diagnosis of epilepsy can be really scary. Seizures can be unpredictable, and they can feel like they're going on forever. And I think families often feel like life will be quite limited by having epilepsy. But I think one important thing we want to support families in and support kids in is making sure that they don't feel limited by their epilepsy, that they continue to participate in school and sports and activities to the fullest extent, that they don't miss out on anything because they have seizures. But we want families just to understand seizure safety. So what are things we can best do to keep this child safe and feel confident in how they would respond if their child were to have another seizure. So making sure they have the tools to stay safe, but also emphasizing how how important it is to continue living life and doing all the things they enjoy and not being limited by seizures and knowing they're not alone.
Let's talk about some misconceptions because, of course, there are a lot out there. But what are things that you've heard over the years that we shouldn't do or things that we should do?
Yeah, good question. There are many misconceptions and kind of stereotypes when it comes to epilepsy. I think one thing is people think that all seizures look the same, and like we've brushed upon, some seizures can look all sorts of different ways depending on where they're starting in the brain. If they're starting in centers that control our smell, they could start with a weird smell. If they're starting in centers that control vision, they could start with some strange change in the vision. Those seizures can look different for different people. Often for one patient, they look quite similar each time, or they feel quite similar each time. So that's one misconception. I think another misconception is that people with epilepsy can't live a typical or fulfilling life, which is just not the case for so many of our patients who, like we said, most of them are able to find a treatment to stop or greatly reduce their seizures. They can feel their normal selves on a treatment without having side effects. They can continue their education, their sports, their activities, their friendships, their relationships, and things like that.
What about things that we, as response wise, I've heard old wives' tales like, oh, you should do this. And I don't even want to say it because I'm going to let you do
Yes.
that. But there are
Yes.
things that we have heard.
Yes, great question. So one is people will say like, "Oh, I reached in there in my child's mouth to make sure they didn't swallow their tongue." Luckily, the tongue is very well secured and attached. Is not something people can swallow. So there's really no. Really reaching in the mouth can cause patients to gag or vomit, which can make things worse. So we want to keep our hands out of a patient's mouth if they're having seizures. Also, people can bite down, and we don't want to get injuries to the caregiver while they're having a seizure too. So that's one we hear fairly often. That's a misconception.
Yeah, I've heard put something in their mouth, like a spoon or something.
Yeah,
Don't do that.
don't do that. Don't put anything in their mouth. Correct.
Okay. All right. We have another comment that I want to share. Mel Gonzalez says, and sorry if I mispronounce, my daughter is here now for her SEEG. Norton Children's has been great. All the doctors and nurses, thank you. Mel, thank you for sharing that positive comment. We really appreciate that and hearing how people are getting help from you all. That is so important. So these viewers who are joining us, they know why Norton Children's stands out and is a leader in our community, but tell us what sets you all apart when it comes to epilepsy diagnosis and treatment.
Yes, absolutely. We have an incredible team of really bright, compassionate neurologists and epileptologists. We've built a pretty large group here at Norton Children's to allow us to provide efficient care to many children within and beyond our local community. We work closely with an excellent epilepsy neurosurgeon. We have a fabulous new epilepsy director joining us as well in the coming months. So we're working to make our epilepsy workups more efficient, allow the capacity for all children who need them to get those workups efficiently, including surgical workups for those who need them, shorten wait times and things like that. So we have a fabulous group here that I'm really proud to be a part of.
Just what would be your message for the parents out there who have a child and they have an epilepsy diagnosis? What would you say to them?
I would say, first of all, we're so grateful for those parents of children with epilepsy. They go through so much. It is not easy being a parent of a child who has seizures or has epilepsy, and we just work with some of the most brave, incredible advocates. So I would say continue advocating for your child to make sure they're getting the care they need. Make sure your questions are answered. Make sure you and your child have a good understanding of their diagnosis and all the options available to you for treatment.
All right. Dr. Clements, is there anything that I am not asking you today that you want our audience to know? I really am excited about the engagement we've had in this conversation, seeing people share their stories, ask questions. That's why we do these segments. Because we realize sometimes, in the panic of things, you may not get to ask all your questions or you're not sure about something. So that's why we do this. And so I really appreciate it. Is there anything I didn't ask you today?
No, not at all. I'm so grateful for the families who have contributed, and you are awesome. We're so grateful for you. Thanks for contributing and sharing your stories.
Absolutely. Folks, if you are joining us here in this stream, I have put a link to Norton Children's Neurology that specifically deals with epilepsy, so you can get more information. You can find out the providers that you can go to. Dr. Clements, thank you so much for your time today. I appreciate you.
Thank you for having me. It was delightful chatting with you.
Absolutely. All right. I'm Myra, and sorry. I hope you have a great day.